There has been a significant decline here in the U.S. in the number of children women are having. Fertility rates have hit a record low, falling by 2% between 2017 and 2018. So to give us some perspective is Dr. Aimee Eyvazzadeh, a reproductive endocrinologist in San Ramon, and she calls herself the egg whisperer, a perfect person to talk with about this. So doctor, does this decline surprise you?
Hi, Heather. Thanks for having me on. The decline doesn't surprise any of us here in the Bay Area, I can tell you. The age of first birth, I notice on average for my patients when I started my practice about 12 years ago was around 32. And what I'm noticing is a number of people are coming and seeing me when they're around 39. And so what that means is that a lot of people are starting their families at a time when they are running out of viable eggs. And I'm not trying to scare people. My patients are extremely intelligent and they're planners, but what we're seeing is our society is changing and timelines are shifting. So when people buy their first home, they're older and they want to wait, they want to plan, they want to make sure that they're financially stable. They want to make sure that they have paid off their school loans, they've moved out of their parents' homes. So of course, all of these things take time, and because society is changing and shifting, it's very normal for people to start their family at an age when maybe they're not as fertile as they were. So yeah. Starting a family at 35, you know, that sounds great because you're more financially stable, you have a job, you have a home, you have a partner for a lot of people, but at the same time, your fertility is something that does not see those same kinds of things.
The clock keeps on ticking, no matter how financially stable you are. So you mentioned the financial aspect here. Doctor, what are some of the other factors that are contributing to this current decline?
You know, it's surprising what we're seeing in the environment, you know, from global warming to pollution. You know, I was reading a study the other day showing that even in dolphins that they're noticing plastic in the urine of dolphins. So if those kinds of things are in our sea animals, imagine what we're seeing as human beings as far as what we're exposed to in our environment. You know, with warmer temperatures, you'll see lower sperm counts, and we're also seeing lower sperm counts in men from generation to generation. So I think it's definitely multifactorial, and that's why I try and educate people about getting their levels checked, their sperm counts checked, and things that you can do so you can prevent infertility if at all possible. But the last thing I want is women to find out at a time when they're ready to start their family that they don't have any eggs left. So that's why it's important to see a fertility doctor, see your OB/GYN, and ask these questions and get checked before it's too late.
Doctor, I do want to go back to that financial aspect if we can, because one thing that really stuck out to me is sort of the correlation between the price of a home and how likely you are to have a child or maybe have a second child. And as we all know, here in the Bay Area, I mean, housing prices are literally through the roof, and we are in fact seeing that have an impact on whether a woman is deciding to add another person to the family.
And it's heartbreaking. I have patients who make the decision not to have a second baby because they just can't afford it in the Bay Area. And then they also talk to me about things related to their jobs and how unfriendly the workplace is for working mothers and how expensive childcare is. So until we make childcare more affordable and create a better working environment for mothers, I think we're going to continue to see this, and we just have to do better as a society.
All right, doctor, thanks so much for talking with us.